Hello, my name is Jasmine Daly, and I'm going to be talking to you about smoking cigarettes. There are many major health risks that come with smoking, and the first one is cancer. So, cancer is the second leading cause of death in the United States, and the types of cancers you can get are in your mouth, the throat, the larynx, your lungs, esophagus, the pancreas, the stomach, kidneys, bladder, cervix, and even in the blood. Another major health risk is cardiovascular disease, and this is heart disease and stroke are the first and third leading causes of death in the US. So smoking causes an increased risk of heart disease, stroke, and blood clots. These diseases are caused by atherosclerosis, which is where the arteries are narrowed and hardened. Carbon monoxide in cigarette smoke damages the cells that line blood vessels and the heart, and this makes it hard for blood vessels to get enough oxygen to the cells and tissues throughout the body. Another major health risk is the respiratory disease. So chronic obstructive pulmonary disease, or COPD, is the fourth leading cause of death in the US. Smoking causes more than 90% of these deaths. Smoking prevents the lungs from fighting infections, and this will cause injuries to the lung tissues where they become red and swollen. So the body uses antioxidants to fight the damaging oxygen molecules, and defensive enzymes fight destructive enzymes. Smoking makes both fighting agents less effective. The last major health risk is reproduction. So women who smoke are more at risk for having difficulties becoming pregnant or not getting pregnant at all because it lowers fertility. Pregnant women who smoke are at a greater risk of having complications throughout the entire pregnancy. They risk having a premature birth, the child having a low birth weight, and even stillbirth. Babies also have a higher chance of mortality from SIDS. So when people stop smoking, some of the effects of smoking are actually reversible, and you will reduce your risk of developing cancer, coronary heart disease, stroke, COPD, and you'll have a healthier pregnancy. Ultimately, you'll save money and live longer. The impact of a smoke-free environment is that secondhand smoke has shown to cause cancer, cardiovascular disease, respiratory disease in non-smoking adults, and it's shown to cause serious respiratory problems for children. A smoke-free environment would prevent all of these issues from occurring for everyone. Studies of measuring air nicotine concentrations to examine the tobacco smoke exposure in workplaces without smoking restrictions have shown to pose a substantial risk to workers. Another impact is that side stream smoke contains higher concentrations of carbon dioxide and carbon monoxide because it isn't being filtered. Smoking is also a fire hazard, and the cigarette butts are biodegradable. So, nicotine is very addictive, and because of that, it's difficult to quit smoking. Some people can do it cold turkey, while others need extra help and support. Statistics show that most people try to quit several times before succeeding, and the longer the cessation, the less likely they will start again. So, the trans-theoretical model, or the stages of change model, can help evaluate your readiness to quit smoking. It's important to ask yourself and to evaluate your current smoking habits, your history with smoking, recognize if you have any temptations, if you have the confidence to stay quit, and to make sure that you have a positive support system surrounding you. Have a plan and set the date to quit, and remember to take it one day at a time. It's important to be a role model of a positive, healthy lifestyle. Leading by example will not just help your life out, but it'll help the other lives around you. You never know who's watching, and you could inspire family or even friends to quit. If you're a parent, children of smoking parents are more likely to pick up the habit than children of non-smoking parents. Some motivation for each stage of change in the pre-contemplation stage. So this is where smokers are not planning on quitting. Smokers in this stage are most likely unaware of the effects that they are causing to their body and the environment, So educating them is helpful in hopes that they will consider quitting. The contemplation stage is where smokers who are considering quitting, but they haven't made an attempt. Smokers in this stage need help with boosting their confidence of committing to quit. The preparation stage is where smokers who have attempted to quit and are planning on staying quit. So offering different methods of how to change their behavior and implementing a plan would help smokers to reach their goals. The action stage is when smokers who are not smoking, it's best to track the smoker's progress so that they can see how far they've come to help them from smoking, to help keep them from smoking. The maintenance stage is the last one, and this is where smokers who are not smoking and haven't smoked for a period of time, to help a smoker maintain their progress, help them to avoid temptations that have been identified, and give them assurance that their behaviors have changed to boost their confidence that they don't need that cigarette. The first aid to help quit smoking is nicotine gum. So this delivers a low dose of nicotine into the bloodstream to help calm the nerves and cigarette cravings. It can be purchased over the counter or be prescribed by your doctor. Chewing the gum may cause mouth ulcers and nausea, and the product should not be used by pregnant or nursing women. A second aid that you could use to help you quit smoking is a Nicoderm patch. The patch relieves nicotine withdrawal cravings as a step-down method that reduces the dosage of nicotine at each level. The step-down method eases withdrawal by making the symptoms less severe and withdrawal more gradual. The patch can cause skin irritation, redness, and an irregular heart rate. It can also be purchased over the counter or be prescribed by your doctor. Thank you for watching my presentation, and I hope this information has inspired you to quit.